Hey medicus, how are you? Hope all of you well. Today we are going to learn the must know topic, especially in med school, for your university exams, viva, spottings. You should know the joints and its classifications. Sometimes we forgot the basic things, and in viva or spotting you may get the example and they give you and they show you the structures. You should write the which type of joints. So let's see the blueprints of the classification of the joints. Before entering the topics, I would want to share with you. To get this note, you must check the descriptions where I put the link. You can download full note with one page. Full note in one page. You may download in HD quality. Not wasting the time, let's start the topic. First of all, we should know what is joints. In my university exam, first question asked me what is joints. Especially we sometimes we forgot the basic things. So don't panic. Just tell joints is nothing but the union or junction between two or more bones or cartilage. It's maybe the union of bones or cartilage. So according to their structure, function, regionals, we can divide the bones in different types. First of all, structural. Structurals, here we can divide according to the structure three types: fibrous joints, cartilaginous joints, and synovial joints. In fibrous joints, especially their structure is united by fibrous cartilage, and here the fibrous joints and cartilaginous joints, there is no joint cavity. So first of all, we enter to the fibrous joints. Fibrous joints further divided into sutures, syndesmosis, and composite. In sutures, here it's further divided into 5 types. There are 5 types of sutures. You can see, and in sutures, the suture is connected by sutural ligament, that is nothing but the connective tissue. What are the 5 types of sutures and its examples? First of all, plain sutures, then serrate or limba sutures, then denticulate sutures, squamous sutures, and the 5th syndylasis. The example of plain sutures is medial palatine sutures and internodal sutures. You should remember these 2 examples, because if in spotting or viva you may show the structures, so you should know the which type of sutures or which type of joints. Then serrate or limba sutures, here the example is sagittal sutures and interparietal sutures. These are the 2 examples of serrate or limba sutures. And in the case of denticulate sutures, where you can see the example, one example is lamboid sutures. Lamboid, where it is present, lamboid sutures is present between parietal and occipital bones. Okay, then squamous sutures, here the example is temporoparietal sutures. And in the case of syndylasis, here the example is between rostrum and between rostrum of sphenoid and upper border of femur. And another example is teratomaxillary sutures. So these are the types of sutures, and these under the fibrous. So we see the next joints that's under fibrous joints. Second type of joints is syndesmosis. Syndesmosis, here the characteristic feature is having more fibrous tissue. That is under fibrous joints. Here in syndesmosis joints, having more fibrous tissue. And what are the example? Example is interosseous radioulnar joints and interosseous tibiofibular joints. And another example is inferior tibiofibular joints. These 3 are the examples of syndesmosis. You must remember these 3 examples. Then third type of fibrous joints, fibrous joints. Then third type of fibrous joints, that is composite. The example is peg and socket junction between tooth and its sockets. What is it? Especially we know the root of the teeth is attached to the socket within the alveolar by periodontal ligament. These are the example of composite. So fibrous joints is over. Here the all of the example, complete example is mentioned here. Then we go the cartilaginous joint. Here we already told that there is no joint cavity. Especially in cartilaginous joints, here we divided 2 types: primary cartilaginous and secondary cartilaginous. Primary cartilaginous, it's another name in synchondrosis, and secondary cartilaginous, here we can see the another name, symphysis. You may confuse in exams, but you should remember these 2 types and say another name, synchondrosis and symphysis. So let's see the characteristics of both. First of all, in synchondrosis, where we can see the here the bone, the joint here the joint composed entirely hyaline cartilage, but in symphysis, where you can see united by disc or fibrocartilage. In synchondrosis, here we can see that it is immovable, but in symphysis here is permanent joint but slightly movable. Okay, and in primary cartilage or synchondrosis, you can see it is temporary joint, because before 18 or 22 years, before 18 to 22 years, here it is temporary, but in secondary it is permanent joint here. And in secondary cartilaginous joint, here occur in medial plane of the body. It is the most important point you should remember. In secondary cartilaginous joints, they are present especially in our medial plane of the body. Okay, then we see the what are the example of the primary cartilage and secondary cartilage. In primary cartilage or synchondrosis, they are the example joints between epiphysis and diaphysis of growing long bone. We know the growing long bone, there is a parts epiphysis, metaphysis and diaphysis. In the epiphysis, joint between the epiphysis and diaphysis, the example of primary cartilage. Another example are spheno-occipital joints, first costosternal joint, costochondral joint and cipisternal joint. And you should remember that first costosternal joint is primary cartilaginous joints. In secondary cartilaginous joints, here we can see the example are pubic symphysis and manubriosternal joints. And also interestingly, these are the joints that presents in our medial plane of our body. Okay, then we go to the synovial joints. Synovial joints is the most important joints because frequently asked, especially elaborately or specific joints in university they are asked, and also in general anatomy the structure of synovial joints are separate questions. Don't worry, I will give you the structure of the synovial joints. Okay, so under the structures of the synovial joints, we can see different structures. Before going that, we should know the classification of synovial joints. Here we can classify it. There are various types in synovial joints. First of all, plain or gliding joints. Actually, they are the synovial joints. They are divided into according to the articular surface. In first type of is plain and gliding, plain or gliding. Second type hinge, third pivot, condylar, ellipsoidal, saddle, and ball or socket. So first joints under the synovial joints is plain or gliding joints. As we know, their articular surface is plane. That's why its name plain or gliding. In hinge joint, so and also the plain and gliding joints are the example we should remember. And also the movement is very important because in MCQ, especially in university exam ask, they are the gliding type of movement they show. Example are the plane. The example of the plain or gliding joints are, first of all, the intercarpal joints, intertarsal joints, intermetatarsals, intermetacarpal, and also one is most important is superior tibiofibular joint. Synovial joints further divided into several types. Actually, they are divided according to their AS, means articular surface. First of all, the plain or gliding joints. Plain or gliding joints, actually their articular surface is plain and movement is gliding. You should know and you should remember this movement, what type of synovial joints and their movements, because you can get this type of MCQ in university exams. So plain and or gliding joints, here movement is glidings, and example you must remember these examples. First is intercarpal joints, intertarsal joints, intermetatarsal joints, and intermetacarpal joints. And another is superior tibiofibular joints. You must know that superior tibiofibular joints is the plain or gliding joints, but inferior tibiofibular joints, here we can see the inferior tibiofibular joints under syndesmosis. You don't confuse. Inferior tibiofibular joints is syndesmosis and superior tibiofibular joints is under plain or gliding joint, that is nothing but the synovial joints. And second type is hinge joint. Hinge joint, here you can see the articular surface is pulley shaped like hinge. Okay, then its movement is uniaxial. Okay, or it's either flexions or extensions. In hinge joints, here the example are elbow, ankle, and interphalangeal joints. These three examples you must remember because it's frequently asked. Sometimes students can't tell this hinge joints, and especially when it comes in university exam like MCQ types, we frequently forget. So we must know and must remember these three joints. That is the example of hinge joints. Third type is pivot joints. Pivot joints, here the articular surface is centrally bony pivot. Okay, actually it is uniaxial joints. Movement is uniaxials. What are the examples of pivot joints? They are the medial atlantoaxial joints. First one is medial atlantoaxial joints and superior radioulnar joints. Superior radioulnar joints you must remember because when you elaborately study specific, especially in BDC or another anatomy book, where we should mention, suppose if the university questions SAQ asked what is superior radioulnar joints, you must know, you must write the which type of joints at first. So the pivot joints, that are the example, the median atlantoaxial joints and superior radioulnar joints. In condylar variety, where you can see there is two condyles, one is convex and there is two condyles is present, and especially in male the condyle is convex and in female the condyles is concave. Okay, it is a biaxial. It is a biaxial joints. The biaxial movements we can see. Example is knee joints and TMG. This is nothing but the temporomandibular joints. It is also most important joints, especially SEQ specific questions asked in university exams, both right and left TMG, temporomandibular joints. Then next type is ellipsoidal joints. Ellipsoidals is oval convex. Their articular surface is oval convex in male and elliptical concave in female. It is also biaxial joints. They move biaxials. Movement are biaxials, and example are ellipsoid joints is wrist joints, metacarpophalangeal joints and metatarsophalangeal joints and atlanto-occipital joints. These are the example of ellipsoidal joints. And in saddle joints and ball and socket joints, saddle joints is nothing but here the articular surface is concave and convex, like the saddle of the horse. Okay, from where the saddle is coming, the name of the saddle is coming. Then ball and socket, here also these two joints, saddle joint and ball and socket joints, they are the multi-axial joints, and biaxial joints are condylar and ellipsoidal, and uniaxial are hinge and pivot. You must remember. And what are the example of saddle joints? Here we can see the saddle joints are first carpo-metacarpal joints, then sternoclavicular joints, then calcaneo-cuboidal joints, and incudo-malleolar joints. These are the example of saddle joints. And what are the ball and socket joints? Especially hip joints, shoulder joints, and incudo-stapedial joints. Especially hip and shoulder joints is most important joint because it's frequently asked SAQ. And another also you can see the hip and shoulder essay questions in university exams. So these are the classifications of the structurals. According to the structurals, the joints are classified into these types. And now we are going to see the functional classification of the joints. According to the functions, the joints are classified into three types. First of all, it is Synarthrosis, Amphiarthrosis and Diarthrosis. In Synarthrosis, they are functionally immovables, and in Amphiarthrosis, they are slightly movables, and in Diarthrosis, where you can see they are freely movables. So, what are the examples of Synarthrosis? In Synarthrosis, the example are fibrous joints, especially in sutures, and primary cartilaginous joints. Where we already seen that the fibrous joints and also primary cartilaginous. Under cartilaginous joints, there is two types, primary and secondary. Especially in primary cartilaginous joints is under Synarthrosis. Especially they are immovable because they are temporarily before 18 to 20 years age. So these are the Synarthrosis. Then Amphiarthrosis, they are slightly movable. Here we can see in secondary cartilaginous joints, they are the slightly movables. So the example are secondary cartilaginous and syndesmosis. That is the example of Amphiarthrosis. And in Diarthrosis, where you can see they are freely movables, especially synovial joints, they are freely movable, and they are the example of Diarthrosis. And another minute type of the classification of the joint, regionals according to the articulations. Regional is especially region specific, skull, vertebral, lumbar, etc., etc. And in according to the number of articulations, there are three types: simple, complex, and compound. So these are the all types of joints. If you want these notes with HD quality, you just check the descriptions. I will put the link of the notes. You can easily download. Thank you for all.